All right, today we've got a real showdown for you. It's pills versus hands-on treatment for one of the most common problems out there, low back pain. So, who's going to win this fight? Let's find out.
You know the feeling, right? We've all been there. You're just living your life. You bend over to pick something up. Maybe you just slept funny, and then bam, out of nowhere, that sharp, awful pain in your lower back. It's just the worst. Incredibly frustrating.
And look, this isn't just you or me dealing with a bad day. We're talking about a huge problem. Low back pain is a massive economic issue in pretty much every industrialized country. It impacts everything, our well-being, our ability to work. It's a big deal.
So that brings us to the big question, right? The one this whole study is about. When that pain hits, what actually works best? What are you supposed to do? Is the answer in a pill bottle, or is there a better option out there?
All right, let's meet our contenders. To figure this out, researchers set up this awesome clinical showdown between two totally different ways of tackling that pain. Okay, in this corner, we have the reigning champion, Diclofenac. Now, that's a common nonsteroidal anti-inflammatory drug, an NSAID. Think of things like ibuprofen. It's the go-to for a lot of people. And in the other corner, we have our challenger, spinal manipulation. This is a very specific, hands-on therapy. They call it high-velocity low-amplitude, which basically just means quick, precise adjustments to the spine.
So, to make this a really fair fight, you can't just ask people what they like better. No way. The researchers had to be smart about it. They designed a super rigorous, top-notch experiment to get to the truth. And how did they do that? They used what's called a randomized controlled trial. Now, you've probably heard this term before. It's basically the gold standard in medical research. The whole point is to get rid of any bias, so you can find out if a treatment really works, not just because we think it's working.
So who were the people in the study? Well, the researchers got 101 patients who are dealing with brand new back pain. We're talking it started less than 48 hours before. And they were super strict about who could join. They had all these criteria to make sure they were really comparing apples to apples,
Okay, now this is where it gets really clever. The whole study was double-blind. That means nobody knew who was getting the real deal. Not the patients, not even the researchers giving the treatments. So look at how they set it up. One group got the real spinal manipulation but a fake sugar pill. The next group got a fake manipulation but the real Diclofenac pill. And the last group, they got a fake manipulation and a fake pill. This kind of setup is absolutely crucial because it's the only way to figure out what's really causing the effect.
All right, so the stage is set. The groups are all sorted out, the treatments are happening, they follow everyone for 12 weeks, and then comes the moment of truth. What did they find? What did the data actually say?
But before we even get to the winner, there's this one detail from the study that just, wow, it really hits you. Remember that placebo group? The ones getting no real treatment at all? A whole bunch of them had to drop out of the study. Why? Because the pain was just unsustainable. They couldn't take it anymore. I mean, that just goes to show you how incredibly severe this pain can be and why this research is so darn important. Okay, so first things first, the results were super clear on one thing. Both of the real treatments, the spinal manipulation and the Diclofenac, were way, way better than the placebo. So the first big takeaway is, yeah, both of these things actually work. They're definitely better than doing nothing at all.
Okay, but that was just the preliminary round. Now for the main event. We know both contenders can beat a placebo, but what happens when they go head-to-head against each other? Who's the real winner here?
And there it is, the final result. You can see it right there. The group that got spinal manipulation had a significantly better outcome than the group that took the Diclofenac. Let me say that again. The hands-on therapy wasn't just as good as the painkiller. In this study, it was better, measurably better.
And hey, don't just take my word for it. Here's the direct quote from the study's conclusion, plain as day. Spinal manipulation was significantly better than nonsteroidal anti-inflammatory drug Diclofenac. Boom. A clear, decisive victory for our challenger.
And there's one more thing that is super important. The researchers also noted that nobody in any of the groups reported any adverse effects or harm. Not a single one. So not only did the hands-on approach win, but it was also shown to be safe within the trial. So, okay. We have a clear winner in this showdown. But let's zoom out. What does this all mean? Why does this matter to you and me when our back starts acting up? Let's just boil this whole thing down.
You've got sudden, acute back pain, a super common problem. A popular painkiller went head-to-head with spinal manipulation in a really high-quality scientific trial. And what happened? The hands-on approach came out as the clear winner. Simple as that.
And that really leaves us with a big question to think about, doesn't it? Given what this study found, maybe it's time to rethink our first instinct, that automatic reaction to just reach for a pill bottle when our back hurts. This research suggests there might just be a better first move to make.